What is neonatal sepsis? What are the different types? What's the cause? How do we diagnose it? What's the management as well as the complication? Well, in this video, I'm going to let you know all about neonatal sepsis. I'm Dr. Farida Rajan Ibrahim Omasundi. If you are new or you haven't liked, please do like, share, and subscribe to this channel. So what is neonatal sepsis? Neonatal sepsis is the systemic infection in infants that occur before 28 days with signs of systemic inflammation. So this is a medical emergency with rapid progression, with a high morbidity and mortality rate if delayed. So what's the different types that we have? So there are basically two types of neonatal sepsis. We have early onset neonatal sepsis that occurs within 72 hours, and this is usually maternally acquired. And we also have late onset neonatal sepsis that occurs after 72 hours to 28 days, and this is often hospital or community acquired. So what are the different common pathogens that causes this condition? So we are going to divide it into those that cause early onset neonatal sepsis as well as those that cause late onset neonatal sepsis. So for early onset neonatal sepsis, the major cause is group B streptococcus or GBS, and also E. coli, Listeria monocytogenes, as well as Klebsiella species. And for late onset neonatal sepsis, we have things such as coagulase negative staphylococci, S. aureus, Klebsiella, Pseudomonas, as well as Candida. So what are the risk factors? So for the risk factors, we can have those that are maternal causes as well as neonatal causes. So for the maternal risk factors, we have things such as fever, chorioamnionitis, as well as prolonged rupture of membranes for more than 18 hours. We can also have GBS colonization as well as UTI in pregnancy as risk factors. And for the neonatal risk factors, we have things such as prematurity, low birth weight, birth asphyxia, invasive lines or catheters, as well as prolonged hospitalization. So how does this present itself? So for the clinical presentation, this is often non-specific. Mostly they are vague signs and symptoms of this condition. So the child will come in with complaints of poor feeding, lethargy, temperature instability. They can also present with respiratory distress signs such as grunting or apnea. They can also come in with tachycardia or bradycardia, as well as poor perfusion. And if there are GI signs, they can come in vomiting. They can also come in with abdominal distension, neurological signs such as seizures, as well as irritability. So what are the investigations? So blood culture remains the gold standard, and this has to be done before antibiotics initiation if possible. You can also do your full blood count, your CRP, your blood glucose. You can also do your electrolyte studies. You can do a lumbar puncture, especially if meningitis is suspected. And you can also do a chest x-ray if there are respiratory signs. You can also do a urine culture in late onset neonatal sepsis. So how do you manage this condition? So basically, management can be supportive as well as initiation of antibiotics. And for supportive care, you do your ABC approach where you check the airway, breathing, and circulation. And also thermoregulation, you have to prevent hypothermia. And you can give your IV fluids or fluid resuscitation, bolus that is guided by perfusion and BP. You can give your oxygen therapy support as needed. You can also monitor your glucose. And for antibiotics, basically for early onset neonatal sepsis, you can give your penicillin G and gentamicin, which covers GBS, Listeria, and many other gram-negatives. And for alternatives, especially in suspected meningitis, you can give cloxacillin plus cefotaxime. And take notes, you have to avoid ceftriaxone in neonates. For late onset neonatal sepsis, this is where you consider antibiotics such as cloxacillin, penicillin G, gentamicin, as well as vancomycin. Yeah, so you can also follow up. You monitor your vital signs, perfusion, urine output, your capillary refill, as well as oxygenation. And you can aim to repeat your CRP or white cell count to assess response. You review your cultures at 48 to 72 hours so that you de-escalate therapy as needed. Yeah, so how do you prevent this condition? Basically, in antenatal, you have to screen, maternal GBS screening, and intrapartum prophylaxis where indicated. You also treat maternal infections. You can give your supplementation folic acid to reduce neural developmental defects. And you can also consider strict hand washing, breastfeeding encouragement, as well as immunization of mothers, which will help reduce neonatal infections indirectly. Yeah. So what are the complications of this condition? So you can have complications such as meningitis with neurodevelopmental impairment. You can have things such as septic shock, multi-organ failure, DIC. You can also have bronchopulmonary dysplasia in preterms with prolonged ventilation. You can have hearing loss as well as cerebral palsy. Yeah, so this was just a brief discussion on neonatal sepsis, and I hope to see you in the next video. Thank you.